And welcome back to The Factor Uncensored. There is a major push underway to get a pill distributed to more Americans to fight COVID-19. It's called Paxlovid. It's already on the market and is used when someone tests positive for COVID-19. 20 million pills are expected to make their way to pharmacies across the country, doubling the current number that's out there. Here with more on this treatment is Dr. Abdullah Kujrath.
The exciting part about this drug is that it's been shown to be effective at reducing hospitalizations and death, and it can be taken as a pill at home.
Now, there's a certain amount of time, how soon you have to take it after discovering that you have COVID-19, right?
Well, not necessarily discovering, but when your symptoms start. Like most antivirals, it works best when taken early, and it's recommended that it's taken within 5 days of developing symptoms.
Now, this is not a replacement for the vaccine, right? What's the difference between Paxlovid and the vaccination that people get out there?
Right, so the vaccine is made to help prevent or lessen severity of an infection. Paxlovid is to treat that infection. Now, as we've seen, even with vaccination, with new variants, you can still get sick. Now, so far, those illnesses are milder than if you were unvaccinated. But say you couldn't get the vaccine, or say you got infected and you have a lot of risk factors, that's when the drug becomes helpful to reduce the severity and the risk of death and hospitalization. Now, one thing that needs to be understood is just because we have this drug doesn't mean everybody needs to take it as soon as they test positive for COVID.
Mm-hmm.
Because remember, the newer variants like Omicron is much less severe than previous ones. So if you're a healthy young person, we have so many examples of people who get COVID, they're sick for a couple of days, they stay home, they get better. So they did fine without the drug. Now, if you're older and you have chronic medical conditions, then we want to consider this drug to reduce your severity and reduce the chances of you going to the hospital or even dying.
Now, it's my understanding that it's currently available at 20,000 sites around the country, and the Biden administration wants to increase that to 40,000. And what are we talking about? Are we talking about the pills are available at like a drugstore, a CVS, a Walgreens, but you would have to get a prescription to get it, right?
That's correct. Currently, it's available at certain pharmacies, hospitals, certain urgent cares. It does require a doctor to write the prescription or the order for the patient to get it. Now, early on, it was very difficult to get because it was in short supply. We're starting to see an increase in supply, but we are seeing some, what's reported as hesitancy of doctors to write for it. I think that's because a lot of doctors are trying to be selective and make sure that we don't give it out to everybody, and then an elderly person or somebody with a chronic medical condition can't get it. But as we get more and more supply, I think we'll see doctors utilizing it more in the right candidates.
And of course, the Biden administration is hoping to increase the supplies around the country within the next few weeks, and we'll see what happens there. But this is in no way a replacement for the vaccine. Many health professionals like yourself are still recommending that people get that vaccine, though, right?
That's correct. The vaccine is still very helpful, but there was a time when we didn't have treatments like Paxlovid. So now we have another tool in our belt to treat COVID infections. But again, I still recommend the vaccine for people, but I understand if people are, for whatever reason, can't get it, then this is another option for them to use if they do get sick with COVID.
Now, we've seen children have the FDA approved children to get the vaccine, but Paxlovid, that's for 12 and up, right?
That's correct. Currently, under that emergency use authorization, it is approved for children that are 12 years and older. They are studying it right now in younger kids, but those studies are not complete as yet.
Okay, so we'll just have to wait and see where that happens. And I saw a recent map from the federal government indicating that Paxlovid is available here in Texas. And of course, there are 20,000 sites around the country. Of course, we're waiting for that number to double pretty soon. Dr. Abdullah Kudrath, thank you so much for joining us here on The Factor Uncensored. Always good to have you and your knowledge and expertise in the medical field, sir.